Black infants are more than twice as likely to die than white infants, a racial disparity that's wider today than in 1850, 15 years before the end of slavery. And Black women are 3 to 4 times as likely to die from pregnancy-related causes than white women.
That there is a kind of racism in the healthcare system, and most of it unconscious. It's a kind of bias that's existed for a long time that we've known about that is affecting the birth experiences of Black women in America.
Beyonce reveals for the first time the harrowing emergency she had while pregnant with twins in 2017.
When Serena Williams gave birth to daughter Olympia last fall, it seemed like the natural conclusion to an easy pregnancy. Williams saying she had to deliver baby Olympia by emergency C-section in September, saying the moment her new daughter was laid on her chest was an amazing feeling, and then everything went bad.
And who's suing a Los Angeles hospital after his wife died during what was supposed to be a routine C-section.
The discriminatory treatment of African American women by the healthcare system dates back to 1845. During this time, a white gynecologist, Dr. Marion J. Sims, butchered numerous enslaved Black women under the guise of advancing medical procedures. Sims, also known as the father of modern gynecology, perfected his craft by performing surgical experiments on these women with no anesthesia. His most significant work was the development of a surgical technique for the repair of vesicovaginal fistula, which is a severe complication of obstructed childbirth. Dr. Sims decided not to use anesthesia because he believed that Black women did not experience pain the same as their white counterparts. It is believed that this ill-guided thought process started the racial imbalances that many people of color experience in healthcare today. The United States has the worst rate of maternal deaths in the world. At this time, it is dangerous to give birth here, and that rate increases 3 to 4 times higher for Black women. Studies show that at least 60% of these deaths are preventable. Culturally, women of color are now pursuing alternative birthing methods, such as hiring a doula. A doula is a trained professional who provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth to help her achieve the healthiest, most satisfying experience possible. Women with doulas are less likely to have a cesarean birth or preterm birth. Meet doula in training Farah Kumari.
I am Farah. I go by Farah Suki. Some people call me Farah Suki, but it's Farah Kumari. I am a mother, a wife, a soon-to-be doula, as well as a massage therapist. It's not only to help women, but as well as their children, their families associated. Being a doula gives one the ability to inform women and their families, to assist women and their families on what they feel is best for them and their children.
Millions of Black women in the United States share similar life-threatening labor experiences. The reason behind the racial disparities are very complex. Primary complications include hemorrhaging, infections, embolisms, and hypertensive disorders. Some of these issues are unpredictable, but in many instances they are not. We met with Terry Smith, an HR professional and mother of 3, regarding her harrowing experience when her daughter gave birth in 2019.
What was the happiest time of our lives quickly turned to the scariest time that I can ever remember. More recently, I had an experience to be my daughter's support person. She gave birth in 2019 to my second granddaughter. The pregnancy was fairly normal, but the birth had complications. I believe it was the lack of communication in terms of the providers at the facility, their ability to relate to my daughter as an African American woman. She complained numerous times that she was in a tremendous amount of pain, and all of her cries for help, for lack of a better term, went unheard.
As Terry's daughter began to push, the baby got stuck on her pelvis bone, causing the doctors to have to perform an emergency delivery. Smith explained it's as if they had to pull her apart like a wishbone just to get the baby out. Unfortunately, the baby was born not breathing.
I began to see life come back into Chloe, and she went from a dark purple to a dark blue, and then slowly but surely life began to form, and I began to see her breathe a little bit more normally. After giving birth, my daughter was in extreme pain. She expressed to the doctors and the nurses in the room on several different instances that the pain felt extraordinary, and she was dismissed. It was truly, it wasn't until she was in crisis and as she got up to use the restroom, she nearly passed out, at which point they then took her concerns seriously. Upon examination, they realized that she had developed a hematoma, which needed and required emergency surgery. The instance itself might have still occurred, but it was the way that it was handled. It was a clear uncomfortability with the providers in terms of talking to my daughter. It was as if they couldn't relate to her, or as if her concerns, they felt that she was exaggerating, or maybe she really wasn't in as much pain as she was stating.
Despite underlying issues such as inadequate healthcare and financial barriers, many would say structural and systemic racism is the leading cause of maternal mortality for Black women. Meet December McCoy, a mother, a doula, and a serial entrepreneur.
I believe that I was mistreated because of my ethnicity. I would tell them different things, and I think they would get intimidated because I was able to articulate. So of course, when you can articulate and advocate for yourself, that comes off as aggressive or argumentative or combative or whatever you want to call it.
December ran into many complications throughout her labor. Her concerns that she was leaking amniotic fluid were refuted by her healthcare providers, which ultimately resulted in her having to give birth by C-section and put her unborn child at risk for being stillborn. Ms. McCoy believed these complications could have been avoided had they listened to her.
They came in about an hour later and said, "We have to rush you into an emergency C-section. You and the baby are about to die." It was straight like that. I had baby, 7 pounds, 13 ounces, 10:49 a.m., February 27th, 2019. I gave birth to my baby boy Hero and my McCoy. The more education you have, the more power you have. And at times, like when a mom may know a lot, but if they're in pain or they're unconscious in a hospital, they need somebody educated enough to be able to advocate for them and to be on their side.
The consistent theme throughout all of these experiences is unconscious biases, racial discrimination, and health workers not listening to Black patients. Healthcare providers need better training and have to become more educated on this topic so that they can improve these outcomes. This topic means so much to me because I almost lost my life because of this issue. Thank you for watching my documentary. Say thank you.
Thank you.